An historic step forward for Franciscan Health, and an incredible breakthrough for people who are in need of a bone marrow transplant who can't find a living match. A company called IBMT Health has created a method of extracting bone marrow from a deceased organ donor's spine. This breakthrough provides new hope for patients with no living match.
For most patients who have diseased bone marrow, either because of an aggressive leukemia or an aggressive lymphoma, people will need transplants where we get another person's stem cells to replace their own stem cells. What we do is we wipe out the stem cells of the patient or the recipient, and then we put in the stem cells of another person in order to provide the person with a new leash of life. What we do first is, one, we have to determine, are you a candidate for that? And that involves a rigorous process whether transplants is indicated or not. Now, when that is determined, the next steps is we also want to find out, do you have any donors in the system? Sometimes, for one reason or the other, you don't have anybody who is unrelated to you who is a complete match. And for that reason, it's also not compatible. But here at Franciscan, because of a new strategy where deceased donors or people who otherwise are organ donors have their bone marrow harvested, and these are actually be able to be used to transplant patients successfully, even if it's not 100% match.
Since this was the first, there were many hurdles to clear. But it's become a standard of care, and it's a game changer.
The survival rate for a cadaver donor and a living donor appears comparable or even better. What we have to keep in mind is that this is a phase 1, and this was first in human. And so far, the survival rates look even better. The rates of graft versus host disease appears to be lesser in the first in human trials. So far, what we are seeing is really, really encouraging.
So we do bone marrow transplants for patients who have leukemia, lymphoma, multiple myeloma, certain blood cancers and disorders. They might be referred to us when they first get diagnosed, and then they'll get treatment with their oncologist, sometimes with our program. That could be a couple months of treatment, and then they'll get a bone marrow biopsy. Once we've established that they're in a solid remission, that's when they'll start the transplant process. We'll find them a match, do their donor testing, try to find them a match, and that's kind of when my process starts of education and insurance, and then they get admitted to the hospital, and typically they're admitted for 4 to 6 weeks.
Franciscan Health is now collaborating with IBMT Health to revolutionize how we care for these hard-to-match patients. One advantage of using deceased donor bone marrow is that it is frozen and ready to be shipped almost immediately.
We don't have to wait for a living donor to get ready. We can get into remission today, and within a couple of weeks, we should be ready to go to transplant by just giving them a call and saying, hey, we just need a product on such and such a date, and they should be able to get it to us.
It also improves the speed for which we can offer this potentially life-saving treatment. In comparison, the process to get bone marrow from a living donor can take much longer.
We tell our patients to have the mentality of an Olympic athlete, preparing for an event. However, when they are getting ready, they actually go through conditioning in order for them to face the challenge that is ahead of them, so that when it's time for competition, they have that extra reserve in order to cross the line. And that's the same philosophy that we apply to our patients here. So we have what we call the transplant optimization program, where our patients, it doesn't matter whether you walked in or you came in a wheelchair, we expect that you would go through physical therapy, occupational therapy evaluation, speech and nutrition evaluation. We do that to enhance your performance before transplant. And what we have seen is that once we do that, patients are able to go to and through transplant and out of it and return quickly back to their regular lives.
The most common things that we address in the TOP program are definitely strength and endurance. So it's very widely known that chemotherapy in general has an impact on your fatigue levels. So we call it cancer-related fatigue. And the cancer-related fatigue, it's attributed to the cancer itself, but also to the treatments that we have to do to cure the cancer.
We still want to make possibilities for everybody who comes to us, and for that reason, we are, going to be in the front, and we are going to be the first in the state to actually do a cadaver donor-derived bone marrow transplant. And so we are really excited about this, and we are looking forward to the future. We're trying to even move the needle further to make things better.
At Franciscan Health, we believe every life is sacred, and every moment is an opportunity to live an extraordinary life.